So pulmonary hypertension is increased pressure in the lung arteries, and it affects people of all ages, affects children. It's rare, it's hard to pick up, and it's hard to pick up because children don't usually get symptoms till the disease is quite advanced, and often gets confused with other things. But now there are treatments available. In the last 5 or 10 years there have been 8 new therapies approved, so the outlook's changed considerably. Started the first one in Toronto, sick kids, way back in 1994, and trained the first nurse practitioner in Canada to look after children with pulmonary hypertension, and then developed another clinic in San Francisco. And then when I came here, people said, well, we don't really have much pulmonary hypertension. And now we're 6 years on and we get referrals from the whole of Western Canada, provide consults to Western Canada, and we're seeing 75 to 100 children with various forms of pulmonary hypertension.
I was 3 months old when we started to think that something was not right. She was failing to thrive, as well as had a series of chest infections. So at 3 months, investigations started. We were very, very lucky, as by 8 months we had a full diagnosis, which is not the norm with pulmonary hypertension. It can take anywhere from 1 to 2 years to come up with diagnosis. So we were fortunate to have a great pediatrician who was very proactive.
Our research has been really aimed at trying to diagnose pulmonary hypertension early, and also without doing a cardiac catheter test, and by using recordings of the heart sounds, and learn to recognize pulmonary hypertension much like a doctor does. But it takes a doctor years of training to do this, and we've been able to get our machine to learn in less than a year to pick up most cases of pulmonary hypertension.
We have a lot of extra special considerations for Sophia. She's on oral medications as well as 24-hour oxygen, as well as she's on a subcutaneous Remodulin IV drug. So those things in itself are a lot of extra considerations. She takes up a lot of headspace every day, always on your mind, not to mention heart space. We are fortunate that she has been stable. So we have done a couple years of preschool, we've done kindergarten, we're now into grade 1. Lots of considerations going into school. I'm not the mom. I'm not in grade 4. Lots of considerations going into school. I put a lot of hours in just preparing the school, preparing her, preparing myself. We're still facing challenges right now in the school. I spend a good chunk of my days there.
I've been looking after children with pulmonary hypertension since 1988. The most rewarding thing has been that it's changed so much. The outcomes were really poor when I first started. Survivals for children with very severe pulmonary hypertension was measured in months, and now we measure it in 5, 10 years. And there's so much hope now for folks with pulmonary hypertension.
My husband has a hard time just knowing that we know that her time could potentially be limited. We don't know for sure how long she has, and we know that a sudden crisis is trouble. I think he feels he sometimes is missing out on a lot of things. So he tries to make up for that in short amount of time. My other children, I have an older son who's 14, an 8-year-old and a 4-year-old. Incredible children. Empathetic, sincere, genuine. They help her in so many ways. They get oxygen, they get medication. If she needs a ride up the stairs, they'll give her the ride. If she's demanding that they get something, they get it. They don't question. Overall, I think it's taught my children a lot about being different, a lot about acceptance. My 8-year-old, we had a little girl in school who had told my daughter, my 8-year-old, that her sister was ugly with her cord, which is her oxygen, and we had a very, very proud mom moment because my daughter said, my sister's beautiful. With or without her cord, she's beautiful. And I think that's just a testament to how she's different, but she's not different. She's our normal.
About how a diagnosis of pulmonary hypertension doesn't just affect the child, but it affects the whole family. And sometimes you feel like it's a worse diagnosis than cancer, because if you have cancer, you go through a series of chemotherapy, and at the end of it, you're cured, and then some people are not cured. With pulmonary hypertension, it goes on. There's no cure. We can make some patients better. For most patients, we can stop it getting worse and keep them going, but at the moment we don't have that cure where we can say to the family, you've done your treatment, now you're cured, that's fine.
My biggest frustration with pulmonary hypertension is that it's invisible. So lots of times people don't understand that she looks well on the outside, but she's extremely sick on the inside, and that it literally takes every breath away. And not that I think that that's anybody's fault. You probably wouldn't understand that if you don't have to deal with it, but it's invisible and it's unheard of. Yeah. And that needs to change. She lives with a lot of anxiety, especially over her IV and changing of the medication cartridges, as well as when we have to put a new IV in. That's a lot of stress. She counts down the days till tube changes. She's Xing off on the calendars. A lot of worry. Self-manage at 6 years old, when most kids can take off on their bike and go, 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 whereas she can take off on her bike, but she has to pick. If I do a lap around the block, I know that I'm done playing for the afternoon because I've worn myself out.
We'll be able to improve the research, we'll be able to improve the care, and we'll be able to allow the children of Western Canada to know that they are being cared for at the same level as children who live in Boston, Philadelphia, San Francisco, New York, Toronto. Without all of you coming together and giving your time, energy and money, this would not have happened. It just wouldn't have happened. Right from my heart, thank you very, very much.
I guess the first thing as a family with a little girl who has pulmonary hypertension that we would have to say is thank you. That's number one. Fort McMurray is an incredible community to come from as well as be part of. We're part of the Fort McMurray community, and we've transferred to Edmonton for her medical needs. Awareness is big for our family. Pulmonary hypertension is rare, unheard of, and not well known, so for us, where it starts is awareness and people getting to know what it's all about, and then we move forward from there. Fort McMurray, just from our family to yours, we're thankful.
So after the open heart surgery, we went down for an appointment, and her estimated pressures are about the same as they were, so no change in the pulmonary hypertension, but no worse either, so we're happy with that. And the hope is that eventually they are going to go down, and maybe in about a year to a year and a half she'll have to undergo another cardiac cath to determine her exact pressures. So Talitha's pressures are in the high 60s, and normal pressures are anything below 25. I think research is really important in the PH world, just due to the fact that these children have to undergo such invasive treatments and invasive operations in order to read the pressures, and that's really the only way they can do it these days. And I'm really hoping that you know, there's a few projects on the go right now that, you know, need funding and that are really exciting to parents like us, because it's going to cut that cath right out, and you know, Talitha will just have to have some sort of device just scanned over her chest, or you know, she won't have to be put to sleep, and that's something that I'm really looking forward to. So.
To thank everybody for coming out today and for all the support.
We're overwhelmed with the support and everyone that comes out to help us.
So let's party, guys, and have a good night, and
thanks for coming out!
Thanks for coming out, yeah.
Woohoo!